This doesn't end in a good place if we are teaching students not to critically think and to simply be mouthpieces for the pharmaceutical industry and for the other industries that have a role in the corruption and the issues that we're seeing today.
Yeah, I can't agree more. And I got to tell a quick story about a doctor we interviewed a few years ago, Dr. Raul Garcia. And he fled communism when he was in elementary school. Yeah. And he sees so many parallels. And some of the stories he tells you about, his mom was a teacher. His mom was a teacher and also a nurse, and they took both of her licenses and some of the indoctrination that was going on inside the schools was just incredible. You almost wouldn't believe it, except you heard it, and then you realize that it's what's happening here, And basically, the critical thinking is, whether your opinion was, when you were telling your students, whether your opinion was right or wrong, I think the most important part is, especially as a doctor or a soon-to-be doctor, you need to decide what's right or wrong. Yeah. And so if somebody has a different opinion, that should be okay. And I tell you, whether it's pharmacists or whether it's doctors out there, critical thinking skills are gone with new graduates for the most part. Yeah. And I think it's by design. I want your opinion on this, but when you think about over the last 20 years, what's happened with medicine, it's basically become cookbook. It's not really an art anymore. You follow an algorithm. It's called standard of care. There's some other buzzwords there too. And you have a little chart where this, that. You don't use your brain to figure out, well, what's really going on with the patient? No critical thinking. What are your thoughts on that?
I fully agree. I've been both in the world of medical education, and also a practicing physician for my whole career. And what I've seen happening the last 6 years especially, has been particularly chilling. We are sinking deeper and deeper into this idea that our students are going to graduate and no longer really be the physicians that we were used to seeing, that were critically thinking and were doing the things that were in the best interest of the patient in front of them. They're being trained to be really mouthpieces for these pharmacies, pharmaceutical companies, tech companies, and follow protocols without questioning. I was super careful in that discussion that we were having on racism. I know what the environment is like right now, right? I was very, very careful with what words I used and what I said, and yet this still happened. And what I felt, I wasn't telling my students they have to think a certain way at all. Their grades were fine. This wasn't, obviously if I had done that, that would be wrong. I was just simply sharing that there's differing perspectives out there, and they just didn't tolerate hearing those, which to me is chilling because, Dr. Martin Luther King is an iconic figure in American history. Certainly having a discussion about his perspectives is important in any discussion on racism, at least to mention it. And yet that whole discussion up until that point, his perspectives were not once mentioned. And I felt it was important for the students to hear that perspective, just from the simple viewpoint that idea that many of their patients will have heard that as they grew up and will have been raised that way. So this is not about my viewpoint. This is about the fact that it's a massively big viewpoint that exists in America. And we need to have physicians who are tolerant of hearing other people's perspectives, really understand where those people are coming from. Those people will be their patients. We need to have people who are tolerant of that.